This recording is going to look at the Wireman model that shows you the blood vessels. Just keep in mind that on the left side of the Wireman, you'll see more arteries, and on the right side, you'll see more veins, even though in some places you'll see a little remnant of some or the others. So we're going to start up at the head, and in the head region, head and neck, again, not really going in any particular order. We have, here is the right vertebral artery. There, it starts down here, comes up here, left vertebral artery, and when they come together, that's the basilar artery. You'll see left common carotid artery stops there. Here is the left internal carotid artery, and going this way is the left external carotid artery. You do see the right internal carotid artery over here on the right. The rest of it's been cut away. You'll also see the right and left external jugular veins. They're very small. Look for that little blue wire that you see right here. Trying to point to it. That little blue wire there, that's the right external jugular vein, and the left is right, that little blue one right there. The internal jugular veins are bigger, so here's the right over on this side, the left is over on the left side. So I'll go back over them in yellow. So right's there, left is there. You'll also see on this picture, you've got the right and left subclavian veins and arteries. So the right subclavian vein is that blue, and the right subclavian artery is that red, and the left's over here. I got the left subclavian artery is the red one, and the left subclavian vein is the left. What I'm going to do is I'm going to kind of zoom in more in this area right here. And so we see superior vena cava right there, left brachiocephalic vein. Right here is the right brachiocephalic vein. Again, you see here's the external jugular, oops, not that one, right there. You have the internal carotid arteries, right and left on either side, and you have the right and left internal jugular veins. See the subclavian veins and arteries again, starting like right over, well, actually we're going to zoom in, start looking more in this area. Also here's the aortic arch that you can see is the aortic arch. Now you're not going to be able to see in this view the brachiocephalic trunk because it's hidden, so it's behind here, so I can't show it to you. You'd have to turn the thing around. So we're going to zoom in kind of more right in this area right here. So starting on the left, you have again the subclavians right there. Then right here, that would be the left axillary artery around the armpit area. Right in here, you have the left brachial artery, and it continues down, and you still see it part here. Now we're going to zoom in down this region, but this branches off into, that would be the left ulnar artery, and then over on this side is the left radial artery. So radial artery is there, the left ulnar artery is right there. On the right side, you'll see more of the veins. That's why we're on the right arm now, and you're not seeing a lot of red. So again, you see the subclavian artery, or not subclavian, yes, right subclavian artery, and here's the right subclavian vein. This right here is the brachial vein, the right brachial vein. This here is one of our superficial veins. This is the right cephalic vein. It actually continues right here. Over on this side, this would be the right basilic. Don't confuse it with the basilar artery, basilic vein. The basilic vein and the cephalic vein are superficial vessels. These over here, we're zooming in on the arm. or the forearm over here. So again, cephalic kind of comes like here. Basilic is right there, and it continues along there. Right, I'm going to do it in green. Here is the median cubital vein. That would be the right median cubital vein. That's usually where blood is drawn. You have right there. That is the right radial vein. And right there is the right ulnar vein. So these are deeper. So if you really look carefully at the model, you'll notice that they're going to be deeper. These vessels up here are more superficial. This over here is actually an accessory cephalic vein, so I won't tag that. If I'm going to tag cephalic vein, I'm going to stay up here, and if I'm going to tag the basilic vein, I'll tend to stay up here, just so you know. Let's see. Now, let's kind of zoom in on this area here. So things that you should be able to identify is one of them would be the celiac trunk, which is right there. Actually has 3 branches that come off of it. One of them I'm not going to tag it, but just let you know, here's like this, but it's easy because it goes to the spleen. That's the splenic artery right there. So that's actually one of the branches of it. You also have right here is the superior mesenteric artery, and right there is the inferior mesenteric artery. You also, here I'm going to, even though I don't want to do it in blue, or actually I'll do it in green, here's your abdominal aorta. Again, I'm just going to highlight this thing. And then that'll branch into your common iliac arteries, but I'll zoom in so you can see that a little bit better. So here, we're down more towards that pelvis area. So here again is your abdominal aorta, right there. And that branches into, here would be your left common iliac artery. This one would be the right common iliac artery. That then branches into your, here's your right internal iliac artery. This would be your left internal iliac artery. Over here is the right external iliac artery, left external iliac artery. That continues on. It eventually become your femoral artery, which you see a little bit right in there. Here, right over here is the femoral vein that you're seeing. Right here, that is your right great saphenous vein, but I'm going to zoom in a little bit later on that one. Let's see. Oh, while I'm here, here is your inferior vena cava, right there. Now the iliac arteries, you have corresponding iliac veins, so that it lines right up. So if this one right here was your right external iliac artery, right there is the right external iliac vein. So if you see a blue running along with it, it's a corresponding vein. So you can do that on your own. So I don't really need to go over those with you. Here again, this time we're looking at the left side. So right here now we've got the left femoral artery. Okay, right in there. I'm going to follow it down eventually right around the back of the knee. There's your popliteal artery. And then you notice down here, we're going in the front is anterior iliac artery, and that would be left. So this is the left side, so everything would be left. So left anterior iliac artery. The one that runs laterally, this is the left fibular artery, or old school, they refer to it as the peroneal artery. Then over here, this is the left posterior tibial artery. Now, if you look at the right-hand side, you see veins. So this one that runs all the way down, that's the right great saphenous vein. It is a superficial vein. We have, it's going to be kind of hard to see. The one that's kind of been cut here, that would be your right fibular vein or peroneal vein. The right anterior tibial vein comes off in front, so it's here, and just, again, it's hard to find a good picture, but on the model it's going to run the most anterior right along the front. So I'm going to kind of try to draw it down. The posterior tibial vein, the right posterior tibial vein, is going to be more medial, and that's going to be, it's real, I'm sorry, I can't really even show it to you on here. So in lab, we'll make a mental note of making sure we can point it out to you. So it's because it's really, really, really hard to see. This here is a small saphenous vein, so I can't show it to you on there. So, but you should see a posterior tibial vein. It's going to run more laterally, but this model, it's not showing it very well. So, other thing I forgot to mention is the dorsalis pedis artery that was on the left that runs over the top of the foot. And let me see if I have this. Is this the biggest? Yeah, that's the most I've zoomed in. So the dorsalis pedis artery is going to be kind of right down in here, runs over the top of the foot. This is where we need to use lab time to our best ability, because sometimes getting good pictures for wire models is hard. Okay, so, but make sure you can identify it in lab.